$25 million trying to continue to sell this thing, make you think you'll like it, saying, listen to me, don't believe your own lying eyes. But we see what's happening with this. We see that costs are going up, not down. We see that healthcare spending is going up, not down. We see people are losing their insurance. Dr. Coburn, Senator Coburn, says he believes 90 million people will lose their current insurance policy based on the rules of Obamacare. 16 million people will be pushed onto the Medicaid rolls. Now, I agreed with Barack when he said in 2009 that the solution to healthcare is to not simply push people onto a second-tier medical system, but that's exactly what he's done. And we all see it happening. And so now we have something very interesting. Last week, Kathleen Sebelius, Secretary of Health and Human Services, she came out and man, she put on the brass knuckles and she did a great Hugo Chavez impression. And she said to these insurance companies, there will be a zero-tolerance policy for you blaming your premium increases on Obamacare. Now that is a direct threat to the existence of these businesses, and I mean that's something straight out of a Hugo Chavez playbook. Now let me tell you a little bit about Kathleen Sebelius. I'm from Kansas City. That's where I practice medicine. She was my governor before she was put into the position of Health and Human Services, and before that she was the Kansas Insurance Commissioner. Under her reign, she chased nearly a dozen insurance companies out of our state, and in the wake left 40,000 Kansans without insurance. That's the kind of hope and change resume she presented to this White House to get her job. So we know about this government health care plan is more about government than health care. Why else would it have a gold tax in it? Why would it have the excise tax that Cisco was talking about on medical devices? They have in this plan that every business, not just healthcare businesses, every business in this country that spends over $600 for a vendor has to fill out a 1099 form and become the tax collector on that business. This is not about healthcare. This is about government. So my message again to them, yes, we can. But let me tell you this. There is a better way. There is a better way. It's like Reagan said, it's not necessarily easy, but it's simple. I can tell it to you right here, I don't even need teleprompters. You know, I got to tell you, everywhere I go, people are trying to get me to say something personal about the president, and I refuse, I resist. I don't think it belongs in politics in any way whatsoever. And frankly, I would rather win in the marketplace of ideas than trying to destroy the man. But I can't help myself, and I'm sure that this footage is going to get back to my mom, it's going to get back to my aunts and my uncles, and I'm sure, like every other night, I'm going to get some phone calls, but I can't help but making fun of the teleprompters. I'm sorry, Mom. Number one, get the government out of the patient examination room. Do you remember last year the government came in and said women in their 40s no longer need mammograms? Good grief. I'm a radiologist. I practice mammography. 20% of my breast cancer patients are women in their 40s. They need mammography. Number two, champion the free market. There are things that we can do in medicine without having the government take them over. Like, for example, tax fairness. Eliminate tax penalties on individuals who want to purchase their own insurance. Imagine that. A citizen wants to go out and purchase their own insurance like a responsible citizen should, and they're penalized with more taxes than if they didn't. And it's a crazy notion, because the reason we get frustrated with those insurance companies, and because I'm not here to carry water for them, but the reason we get frustrated with them is because they are not our customer. They are our boss's customer. They are our employer's customer. They're trying to please them. They're not trying to please us. I mean, we're almost secondary to them, but that's the system not created by the insurance companies. That's the system created by our government. Eliminate that. Make these insurance companies answer to us instead of to our employers, and they will listen to us. Why is it that we can get a personal pan pizza exactly how we want it? Why is it that automobiles improve every year? Why is it that costs go down on electronics? Because those companies want to please you. The health insurance companies aren't forced to please you because the government chose that, and that's not their own fault. So we can also do innovative things with the free market, like the health savings account. Many of you may use that. It's a remarkable tool that brings down healthcare costs and does not hurt the quality of healthcare. It's actually, I think, the only vehicle I know of that creates such a thing. And Obamacare has the ability, with the stroke of a pen, to destroy every health savings account in this country. Finally, number three, stop the frivolous lawsuits. We spend around $200 billion a year practicing defensive medicine. $200 billion a year that we could treat children with diseases, women with diseases, men with diseases, but no, we're going to spend it on lawyers. I think that money should go to people in need instead of slick lawyers like John Edwards. So So I have to say, I go out and I talk about this, I talk about healthcare, and I have to remind people, I'm against the plan, I'm not against the man. I'm proud to say that I am Barack Obama's cousin. I don't know that we have very much in common when it comes to politics, but both of us claim the McCurry family as our own. Both of us claim the heartland of America for our heritage. Both of us are benefit from hard work and education. And I have nothing against him personally. I don't need to tear him down individually, just as the first Tea Partiers did not need to destroy the reputation of King George III. Again, I'd rather win in the marketplace of ideas, but I haven't been secret about it. I haven't been quiet about it. And so I was invited, he invited me to come in and talk. I don't know if I was summoned or invited, but I'll tell you, it felt a lot like when I was in high school and called to the principal's office. And I thought, maybe I should bring my wife and kids with me just to try to buffer the situation a little bit. And I'll tell you, I won't betray the confidence of the conversations that we've had. Most of them have been on a personal nature, and I can say, I guess we can disagree, we can agree to disagree, whatever the euphemism is. Our mothers grew up together, and we at least agreed that a mother can be proud of their son, even if their sons are at odds. And most of it was very kind, and most of it that wasn't, I'll keep to myself, except I can't help myself. I have to share this one thing. And I told him, I said, listen, I really can't resist. I really have to ask you this question. Am I the only Tea Partier you know? And I'll tell you what, it took him back. It took him back a bit, and I think he was a little freaked out that he was in the presence of a Tea Partier. And I'm not going to tell you everything he said, but I'm going to say, suffice to say, I believe I am the only Tea Partier he knows, and I hope you can trust that I represented you well. I'll tell you something. I disagree with him on just about everything. I disagree with him, hold on just a minute, just about everything, and so many of his programs, and except one. There's one of his programs that I just love, and I have to say that before I studied medicine, I was actually a student of economics, and one of his economic policies I absolutely love. I mean, he's wasted so much money in bailouts and stimulus spending and all of these regulations and all of this, the bank laws, all this kind of stuff, but one fantastic program, Cash for Clunkers. Now, don't get me wrong, I don't think it's a great program economically. It's an utter disaster economically. But it's the perfect program. Frankly, I think we probably ought to run this every generation just so young people can see the disaster of what a bailout is. This is the simplest bailout you could ever have. It was for a finite period. We could measure it from beginning to end. And it's just like every government program that ever existed. They came out and they said it cost $1 billion. It ended up costing $4 billion. They said, you know what, we're going to give you money if you'll drive the car that we want you to drive because we know better than you what car you should drive. And by the way, we probably ought to pick the brand of tea you're going to drink while you're driving that car, but we'll work on that later. We're going to choose your car, and then we're going to destroy your car. So let me find an economist out there somewhere. I'll have this debate anywhere they want to have it to say that it's good economic policy to take our time and treasure, to take our resources, to build durable goods, and then to use more of our resources and destroy those goods. It makes no sense. We all know that. But here's what's interesting. They came out and they claimed about how